Hey everyone, welcome back to another STC podcast recorded under the auspices of the NCIHC, that's the National Council on Interpreting in Healthcare. And I am back with our first repeat guest, and I'm so excited. This is Margarita Larios from New York State, the Executive Director of the Office of Language Access, something that didn't exist 2 years ago, and something that Margarita is the very first director of. So I'm so excited to hear about the creation, evolution, and what has happened in this past year since we first spoke. The first, for all of you who missed podcast number 8, let me tell you a little bit about Margarita. So before joining OGS, Margarita served as the Director of Operations and Language Services for New York City Health and Hospitals, the largest public healthcare system in the country. Wow. During her tenure, her team expanded and optimized the healthcare system's delivery of high-quality language services available 24/7 in more than 200 languages and dialects, through innovative solutions such as the creation of a language services usage dashboard and the implementation of an interpreter skills training for bilingual staff. Margarita is an experienced translator and trained interpreter. She also taught courses on professional translation at Brooklyn College and has worked with various media outlets to manage transcreation projects and multilingual website operations in the public and private sectors. In 2016, she received the Innovation Award from the New York City Department of Health and Mental Hygiene for her contributions as the founding translation manager for the agency's Language Access Unit. Margarita received her BA in Latin American Literature from the Universidad Iberoamericana Ciudad de México in her Master of Fine Arts from New York University. So welcome back, Margarita. I am so excited to have you join us again. And I want to hear all about this past year. What has it been like? What were your goals? Where did things fall short? And mostly, what were the unexpected nuggets of learning or challenge that came your way? All to you.
Muchísimas gracias, and thank you so much for having me again. What an honor to be the first repeat in this wonderful podcast. That really is such a wonderful place for us to find that solace that we need, right? And sometimes as a language access practitioner or a linguist, one feels lonely at times, right? To have a space like this where you can feel like, oh, yes, I know exactly what that feels like, or I've been in that situation is such a wonderful thing, especially when we talk about an important space like healthcare. So thank you so much, Eliana, for having me. And boy, what a year it has been, right? I know that there have been, of course, the challenges of the times we're living in currently, also with COVID and getting used to what we're calling the new normal and all that. But I have to say that for me, as you mentioned and very kindly shared, the Office of Language Access has really been what my mind has been wrapped around for the entire last year. To share also for those who may have missed that episode 8, the Office of Language Access was established in October 2022, so almost a year at the point that this is airing for folks to watch. And I'll also say that this was in the context of Governor Hochul codifying the language access policy for the state in April 2022. So we have the fortune at the Office of Language Access that lives within the Office of General Services to be overseeing, providing coordination and support to the agencies covered under this law, more than 40 agencies doing so. And really, to get the wonderful opportunity to collaborate with folks who this means a lot to personally as well. There's a language access coordinator at each of the agencies that are under this law. And I can tell you now, almost a year in, that in the 3 quarterly meetings we've had, it's just and there's something very special about a room where you gather folks who really are focused on language access and know the importance that language services and interpreting makes in people's lives. Like there's something in the air. And I'll also say that, with this new law, more than a year now since it got codified, Section 202-A, we're really wanting to make sure, that we have what's necessary to comply with those requirements as we do, but also we're seeing the opportunities to standardize, centralize, optimize with the agencies. We're keeping our eye on what's happening out there with technology and what are the best practices. So many different considerations that go from how should you try to think about plain language and the way that you speak in a conversation with an interpreter. Clearly very different from my very long sentences and my tone right now. But also thinking about things like, best practices from a procurement perspective. So, or data-driven decisions. So there's been a lot for sure to go over. I will tell you that if you ask me what's been, like the highest point, for sure is to tell you that, we have a full team now, and we are, moving forward in a lot of the things that we're planning. But I don't want to get ahead of the questions, and just wanted to share that, brief recap of what it's been so far.
So I know what it's like to have a newly created position or a newly created service. When I was with Harborview Medical Center, we implemented video remote interpreting back in 2008, when a lot of people were hesitant. And we found that getting people involved at the beginning, rather than presenting them with a done deal, a fait accompli, as it were, was a much better approach. We could go to the community centers that were organized around different cultural and language groups, like the Vietnamese or to the Chinese or the Somali, and show them the cart and show them that there was no place to put a disc or a recording device, and that it was more like a radio, that it was on or off, and less like a VCR.
Demystifying it, yeah.
Yes, mystifying. And assumptions that we had made assumptions, for example, that women that were religious and Muslim and had covered their face or head would not want to be seen on camera. And that was not true. So you can't make any assumptions. You just have to present what is available and ask people for their feedback and their concerns, and then allow them to interact with it. Same thing with the staff. You had to bring the cart even, in the middle of the night to the night shift and show people, you press the green button to make the call and you press the red button to end it. But they had to actually touch it and do, for them to be able to then easily access it as needed, rather than when you go around to the different units and clinics, you find the video cart dusty in the closet because people are afraid, like first time off the high dive, to take that leap. So can you share with me what some of your experiences were in getting the word out or getting people to participate or to overcome that hesitancy with this brand new thing, the Office of Language Access?
I love that example that you share with us, and that background story, because it's very fitting, right, to what we're talking about, in the sense that when you can't see something or you can't interact with it or be part of the planning for it, it's scary, right? Like anything unknown is really scary. Like if you know something is not going to be, you don't have the details for it and you don't know how you will interact for it, it's hard for you to imagine yourself using it, right? So I absolutely relate to what you're referring to in terms of cultural humility too, right? Because I think that's what it is. We can prepare ourselves and try to think of all the possible scenarios and workflows to operationalize something. But at the end of the day, even when you know experts in the different languages and the different cultural considerations, that cultural humility is what brings us to just bring it more as a question than as a, this is how it's going to work, rather than figuring it out together. So that makes me think of our process so far, in the sense that, with the office establishing in October of 2022, you can imagine that one of the first priorities was to get a team, right? But I'll also say that we were so fortunate, or I have been so fortunate in that, like I said, the agencies that are covered under this law had been providing language services for a while. Now they have the support and ability to expand with a legal framework. So, of course, it's a whole new frontier, right? But they already had a good foundation for it. That's one part of it. And then on the other end, to see that, we were able to find the exact right person, I would say, for the roles that we have in our office. The latest edition, someone who's doing our data analysis work, our data analyst is looking at, the different ways that we can interpret data, or get data to understand things like what are the age groups in the different top languages, right? Because that makes a huge difference, also depending on the service that we're thinking about. But we can do all of that research, and then we have to approach the actual delivery of services with cultural humility. So back in January, I had some feedback sessions with community-based organizations. At that point, we still hadn't fully sourced a team, so it was a smaller undertaking that what I can now report has been our second series of feedback sessions with community-based organizations. We've talked to over two dozens of them, and I'm so happy to say that it's really eye-opening, in the sense that we are able to hear firsthand from folks that are helping provide the services to New Yorkers with limited English proficiency. What are the challenges that they're seeing, and how we can address them and find opportunities for collaboration and to get feedback in a way that is conducive for them to share it, and also actionable for us. So, we've been busy at work doing that. And I'll also say that we are currently in the planning stages for our listening tour that is happening this fall. And it's at the time that this is airing, I think we'll be in the thick of it. And we're going to travel, across New York State. 7 different in-person town halls we'll have with the community, hoping, that we can spread the word about the fact that New Yorkers have language access rights, and, they should feel empowered to ask for them and to get those services. But also we want to hear their feedback and their experience in getting these services. So we're going right to the source, talking to folks through those town hall sessions. We will also have an additional virtual session, because we acknowledge, that not everybody can travel. So that we want to make sure that there's an opportunity for folks to join us, at least virtually, and let us know how they've been feeling about the services, when they get language services while receiving services from New York State government. And the idea is that, once we go through those town hall sessions, we will compile that information and help inform future planning and improve services. Like you were alluding to earlier, we do the planning, we do the due diligence, but at the end of the day, we have to listen. And we're so looking forward to doing that. I will add here that we are promoting that through our media awareness campaign, but I can tell you more about it in the context of the rest of our conversation. Oh, you're on mute.
There we go. So background noises of kitties are now gone. That's really exciting, because I know how effective town halls can be, whether it's for an organization or a hospital, or for people that are interested in organizing at the political grassroots level. It's really important for that first point of contact for whoever is going to engage with a service, for example, to know this is the person that runs it, or this is the section, or this is the city hall office, or this is where I go. And the opportunity to share both good and bad experiences is really how the service can customize itself so that it's a better experience for everybody involved. When you are delivering a service and it doesn't work, there's somebody that has to hear that complaint. That's not an enjoyable experience. The person who did not get what they expected and had bad service from their point of view, it's also not an enjoyable experience. But to have a place to take that to, it's really priceless, because so often there is nowhere to go with that. You just have to kind of sit with it. So being able to have a two-way communication is really how you keep getting better and better and better at doing whatever it is that you're doing, whether it's language access or providing interpreters or translating information or getting community engagement to participate and use the service. So that brings me to my next question. This is the big thing that language access always fails to adequately provide for, and that's budget. Is New York State actually giving you sufficient budget to carry out your ideas? Because if so, we need to really make a fuss when this podcast is uploaded onto YouTube, because every other state needs to learn how to do this.
Oh my gosh, yes. And that's such an important part of what we're doing, right? Like, of course, the priority is to make sure that language access is efficiently and effectively provided across New York State. But I also see that we play such an important role in helping other states, right? In helping think about the operational concerns or how you can plan for it. How you can plan your budget. So many things that we shouldn't reinvent the wheel. And I know that there are so many great resources, including the Municipal Language Access Network, where there are so many practitioners of language access sharing ideas and just having like that generous exchange, I would say. But to answer your question, we are incredibly fortunate to have the support of the governor and Commissioner Moy at the Office of General Services. I have to say, there hasn't been one single moment where I haven't felt supported to do the great work that we're doing. And we're also, working on our relationships with folks in the community, because that's another hugely important thing, right? We can have the backing and we can have the plans and we can have the avenues to do it, but at the end of the day, we need that buy-in, and that buy-in comes with the trust and seeing that we're hearing what is necessary and what's needed. So I can tell you that we've been wanting to make a fuss about the fact that we have these services, and the first phase of that was our Office of Language Access Toolkit. We created for the 46 agencies a suite of materials, some of which is public facing and some of which is internal. The public facing part of it is, language ID posters, I speak cards, a couple of different versions of them, one with a blank and another one with like checking boxes option, and language ID desktop displays, as well as, and I think this is really the most important part of this toolkit, brochure about language access rights in New York, like a bill of rights of sort, if you will, right? So this is a brochure that explains in plain language what are New Yorkers' rights when it comes, to getting services from these agencies covered under Section 2-A. And through it, we meant to address really two pieces of feedback that we had been getting, not just from agencies, but also from community-based organizations that work in the language access space. We need to raise awareness. We need to educate folks about the fact that this is something that is their right, and for them to feel empowered to exercise their rights. So we've delivered those toolkits to the 46 agencies over the last month. After that, we had our third quarterly meeting, walked them through what these materials are and how they can help them out. And now, we're moving into that new phase where we have been talking to community-based organizations about these materials, sharing it with them, because there is also the digital version of the I Speak card, as well as the digital versions of the brochures in more than 25 languages. And the next phase then of this, like bringing awareness and getting feedback, is the listening tour and the town hall sessions. So it's been kind of like a phased approach to raise awareness and then, going into getting feedback. That has been our focus for now. And I'll also say that it has been a great opportunity to learn a lot, especially about ASL. ASL is a language that I know keeps coming up in our conversations because, historically the deaf community has been underserved in the language access space, not necessarily being recognized, folks who use ASL as someone with limited English proficiency. And we know that that is the case, right? It is exactly the same situation as someone who's having to learn English as a second language. So we've been very intentional in our Office of Language Access Toolkit and having the back of our brochure talks about ASL just as did you know that there are so many variants of language, of sign language? Obviously, ASL, obviously for those of us in the language access space, ASL is the most commonly used sign language variant in the United States and Canada, but there are so many others. And we've also addressed that really important gap that we had been hearing from members of the community saying there is a challenge of the shortage of ASL interpreters in the nation, right? And then there isn't written ASL. So how do we bridge that communication in the very specific challenges that we face to supply language access to folks who use ASL? So we're very happy to say that we collaborated with the Office of the Chief Disability Officer in creating ASL videos, interpretations of key documents that are now available on the Office of Language Access website, which is languageaccess at .ny.gov. And they're also available in the Office of General Services YouTube playlist. We created interpretation videos in ASL of our website, of the Office of the Chief Disability Officer's website, and of key documents across 10 agencies. And that's, ongoing work. We're going to continue to upload those. We have 30 of them now. That's going to continue to grow. We expect to have doubled that by the end of the year. So we're really, appreciative of the opportunity to have learned so much from our colleagues, from experts in the ASL field, and to be able to provide this creative solution, because it wasn't very obvious to us at the beginning how we could address this. And now that, we're past that planning and the video production and all of that, we're so happy to be promoting it.
That the fact that you have institutional support and sufficient budget, girl, you are living the dream. But what you said at the end is so important. Having all the material and the toolkits is a wonderful first step. But then how do you expand the ripples of that pond? How do you get a broader reach? And having videos, not just for ASL, but in other languages and available easily, like your page on YouTube, is another great way. And then something that people tend to forget the younger they are, there are still radio stations that broadcast in a language like Spanish, like Haitian Creole, like Vietnamese, and you could have a public service announcement directing people to go watch the video in their language. And obviously radio is not a good choice for ASL, but for all the other languages that are there, I know that there isn't a radio station for every language of limited diffusion, but there certainly are multiple Spanish-speaking radio stations, as well as probably TV channels in New York City, and you could get a little PSI in during the telenovela or something.
Oh, yes, it has to be during the telenovela.
Place to insert churches, supermarkets, gathering places. I remember somebody asking me, I'm in Japan, how do I find a Portuguese, Japanese interpreter? I've advertised in the paper here, there, and I can't find them. And I was like, do you have soccer matches in your town? Put up a poster.
It's about knowing about the culture, right? I love that example, Eliana, because to your point, it is something that is absolutely top of mind, because we've been trying to be very intentional about the approach for each language. And of course, language is culture. So there's a whole suite of considerations when you're thinking about how you approach each language. And I did want to say, before I tell you a little bit more about our media awareness campaign, that yes, living the dream with the backing and the support that we have, but also I have to say, and this is one of the key ingredients in the recipe, is I have such a wonderful team, Eliana. I'm so fortunate to have Alejandro, Mirna, and Tushita, who are so committed to the work that they do. They are personally invested in it, and sometimes we sit together to talk about, our plans and what we've accomplished so far. We're like, how and when did we do all this? Like, it's just really, the fortune of having talented, professional people that are willing to do this work, even though, it's challenging and it requires a lot of creativity, because to your point, we're building something new. So we're modeling and building the plane as you fly, as they say. But this feels like a very safe plane because I have a wonderful team. And I did want to mention that. But, for the media awareness campaign, I'm glad you mentioned radio, because definitely it is part of our components. So our media awareness campaign launches in September 25th. At this point, folks should have seen our ads. And we're going to have TV ads, we're going to have radio ads, we're going to have print and out of home ads. So people should have seen across New York State that the Office of Language Access exists. And we've also wanted to do it in a way that not only makes folks aware of language access, but also brings attention to the diversity that exists within each language. And through that, bring inclusion and belonging, right? Like, this is what New Yorkers look like. And in thinking through the collateral for this ads, it's like, well, what does someone that speaks this language look like? It looks like anyone. It looks like all of us, right? And that has been really just such a beautiful opportunity and experience, to take the time to think about that diversity and in the many ways that that's represented, through, obviously the most obvious ones, race, ethnicity, but also gender, sexual orientation, visible disabilities. So like it's been a wonderful opportunity to just show the tapestry that New York State is, and taking those opportunities to think, how can we best promote this, right? There are some languages that we know are not going to be using internet, right? So how do we best reach them? Through print. And there are others that we know are early adapters of technology. So we're going to go heavy on Facebook. So it's just, we know that there isn't one approach that fits everyone, and being able to have experts around and colleagues, in our media services center that are so wonderful and so experienced in this really has helped us, tackle something that is very innovative and new in its approach, but that is really so inherently New York.
I love that. If you've been in the city for any length of time, I used to live in New York City. Benetton had a series of ads that had children of every race and every eye color and every hair color, all wearing whatever that season's offerings were. And I used to love them because of the diversity expressed without having to put in big letters diversity. Right. It was just there, implicit, built in, and that's New York. It's already there. Let's take note of who's in the room and how we can best serve them. Yeah. So looking forward, you're past the town halls, you've collected information into all these different buckets. Do you have a timeline for deciding what you're going to do with that information and to pivot and put some things into motion?
Well, the decision of what we're going to do with it is already made. We're going to use that and see how we can improve any and everything that comes up in the different, but obviously, as depending on what the feedback is, planning it for longer or short term, right? But that's what the main point of the town halls is. Like, the listening tour is meant really to help us do three things: raise awareness, get feedback, and really build trust with the community. That's our focus, right? And from the information that we get from there, we will identify where are the areas and opportunities where we can do better, and also try to think of them from more granular perspective, right? Because we know that some of the feedback may be specifically for healthcare purposes, right? Where are the instances where one can help with plain language, for example, or plain talk when thinking of healthcare providers, right? And making sure that they're working with the interpreter to provide that effective communication. Or maybe, we'll hear some other feedback about things that are more related to documents and the way that documents are shared. So the idea is to use that, and what the timeline is for it, I think it's going to vary in the sense that some of it may be things that we can get done in the short term, and some of it will be part of our longer, cultural, language justice approach, right? I think that last time that you and I were talking about, how the focus right now, or rather what's more immediately in the present, is language access, ensuring access, right? But what all of this, we hope, is fostering is language justice. And that's what our ideal is, that folks will feel empowered by their language and not the opposite.
Oh, that was really well said. I'm going to go back and listen to that part again. So, is your team as big as you would like it to be?
Oh my gosh, if it were up to me, everybody in New York State would be as big, it would be part of my team. But I will tell you that for a foundational stage, I'm very comfortable in the size of the team that we have. Of course, the hope is that something like this continues to grow, right? Because, we thinking again about that language access, language justice, there's always incremental steps we can take, and we can be doing so much better now, but we will even in the future. It's being something related to culture. I know that there will always be opportunities for us to continue to expand and figure out how we can assist folks better. I definitely see that outreach is going to continue to be very important, our collaborations with the community. And of course, that requires the resources for it. So definitely that would be one of the areas that I can envision wanting to expand into as well.
So, any lessons learned? And I'm thinking of what we can share with people who are interested in creating the same thing in other states, because we really don't have this office in other states. I think we should, whether it's for the whole state or whether you have one each for healthcare, courts, social services. I still think having just one is better. But how did, and I'm actually going back in time now rather than forward, but how did the seeds get planted that germinated into the creation of this office? Because other people need to know how to plant that seed.
For sure. And I will say that, before I get to that, I was also left thinking about your question about the team. And that's the Office of Language Access Esteem, but I didn't factor into that answer the language access coordinators. Like I said, there's a language access coordinator at each of the agencies that are covered under the law. And so many of them share this work also with someone else on their team. So it's a growing team in that sense as well, even though, we don't necessarily interact on a daily basis. They are dedicated to making sure that everything language access is running the way it should at their agency. So I think that's one of the key parts of the answer to your last question. How do you get something like this going, a program that can oversee language access? And I think it has to do, again, with cultural humility, right? In the sense that I can provide resources from a central perspective. I can help with oversight, and I can help with coordination, like on a bird's eye view level. But I also need to be able to know, what are the specific needs that Department of Labor has, or Department of State, or the Office of Mental Health. It's a culture within itself, right? And you need someone who is focusing specifically on that. So I would say there is a lot of value in a model that centralizes, but there needs to be someone like boots on the ground, so to speak, that can be observing and taking in the things that are happening, or resolving complaints. Because going back to our the earlier part of our conversation, we have, and I really want to promote this also through our listening tour. We have a complaint form in our website that we really want folks to be filling out if they have, a bad experience. Of course, we want to do as much as we can to avoid that, but we are realistic and we want to get that feedback, and that's how we improve, right? So language access coordinators get this, and they're working to make sure that that's being resolved at their agency level. And then from our perspective, we also see, okay, what are the opportunities like statewide, right? So that's one thing. And in terms of planting the seed, I think that now is a great moment to be thinking about that, because diversity, equity, and inclusion conversations definitely have a lot more fuel than they used to have. Now is a breaking point in the sense that I feel the traction and folks committed to it. And it starts, I know, with the community. Like, we wouldn't have been able to get where we are without having had, constituents say, like, we need this, we need language access, and these are our needs, and we want to participate. We don't want to have barriers in accessing these services. So it started with that, and obviously with Governor Hochul's administrations, specifically now in the context of the creation of the office, saying, let's take this to the next step. Let's create the legal framework for it, and let's create an organism that can make sure that this is working the way it should, that it is being implemented. So I really see it as a collaboration between the general public, the constituency, and public officials who champion this, right? So and it's not hard to find folks that can champion this, because it's not hard to find a link to language, right? Or to understand that this is the very basic condition of effective communication, and that without effective communication, you don't have engagement with your constituency, or you don't have participation, meaningful participation from your constituency. So I don't know if I answered your question, because it's not, I don't know that there's specific, like, a checklist of steps. I think it starts with, those conversations with the community, and also, probably assessing, like, what is the language access plan? I don't think it's too early, even when you're planning to make this move, thinking about what are the different language access plans for the different organizations involved, right? Because that helps you think of the operational concerns, that will help you think about your budget, about your, team needs, and, like, really, when you envision how it is that you're going to do it, going back to the example of the tablet, right? When you put yourself in that situation where you're providing the services, that helps you think of all the different ramifications of it, including the resources, who needs to be at the table. And that I do think that it is an advantage point in time to be thinking about this, because there is traction and there is visibility to the fact that there are now 2 language access offices in our country, Hawaii and our own in New York. So we hope that we get the opportunity to support folks who are trying to do this. And my office is more than happy to connect with anyone, across the state who is wanting to have a conversation about them.
That's great. And it just makes me more convinced than ever that I need to find somebody to interview that is a grassroots organizer, to share tips with people who have the same feeling, the same urgency, the same desire to make some changes, but just don't know how to get started. We need a grassroots organization workshop. So that'll be coming up hopefully before the end of the year.
I have a few organizations in mind. We can no, but to your point, there isn't shortage of organizations that are doing participatory research and that are advocating currently for language access rights across the nation. So I definitely think having folks in a podcast like this one would be so enlightening for many of us, because there are considerations about how, not just what the need is, but also how can you bring visibility to it in the most efficient way, in the most organized way. And that's such a whole different body of skills, of knowledge and understanding. and network.
How do I organize this to bring it to a table so that people will listen and give it consideration? And then there's details about how you actually move it into legislation. But that first, how do you get the ideas or the things that interpreters always complain about, or that translators always complain about, or that limited English proficient patients, families, users of the system say, oh, this is always a problem when I go to ABC place. How do we make that change? Well, we need to unite, but we also need to not be, it's like walking 10 different dogs, right? It can all go in a different direction, or if there is a purpose and some organization and someone willing to call out names and point in a direction, we can all pull, right? And 10, 20 dogs pulling the sled in the same direction, you get there fast. 10, 20 dogs pulling in different directions, you don't get anywhere.
I love that metaphor, because yes, it is like walking a lot of different dogs, but also like I feel like in different directions and with different lengths of leashes, right? In the sense that you need to be thinking about what you have to gather right now. You need to have the foresight to think about what is going to go wrong, because things will go wrong. You need to have plans B, C, D, right? And just, I think, having an assessment of what's also going to be the quality assurance process, right? Like what's going to be the mechanism to get feedback. Those two things are absolutely essential, because you can plan the best that you can and consider, the current feedback of folks. But once you implement, and also, there's things outside our control, like things like a health emergency or other things that, we can foresee that there will be changes. We can't necessarily foresee what those changes will be about, right? So if you have a way to get feedback of what's working and what's not working, and you also think of it in a way that is actionable, right? Because even just in the way you ask a question in a survey, right? If I only ask open-ended questions, then it's going to be hard for me to compare or find trends. But I also need to make sure that I ask open-ended questions, because otherwise I don't get the experience of the person that is sending me their feedback. So that, and the quality assurance for whoever you're working with, the linguist you're working with, because it's also a protection for the interpreters, right? Like there needs to be a standard that everybody is held to, but also in guidelines, right? Like we know that we shouldn't be asking things like, interpreters to do on-site document translations. That's a different skill set, right? And especially when we're thinking about healthcare, highlighting the different roles of the interpreter and understanding them and educating folks working with the interpreters is such a huge part of it. So, trainings for someone who's using language services, meaning staff, for example, that is going to use the language services to provide them to the public, is a huge part of the plan that you're creating. So, and definitely falls within quality assurance. So I think that those are important avenues to think about as well.
What you said about the way you ask the question is so earth-shakingly important, and not the easiest concept to convince the people who design the applications for you to register, healthcare intake, all of that, the languages that are appearing as choices, or even simply moving from asking, do you speak English, which can be interpreted like, oh, I better say yes, or they'll turn me away, to what language would you prefer to discuss your healthcare in? Oh, well, now it's
an empowering question, yes.
Right? And now I can say, well, I do speak Spanish, but my first language is really Quiche, and you get some trust and dialogue going, as opposed to that almost like hands up. Do you speak English? Yes or no?
I love that you give that example, because it also eventually it gets also to the benefits of this, right? Like it's not just to do it because it's the right thing to do, but it is also because you sow the fruits of making sure that you have all of your constituents being able to make decisions, get the information, and participate actively, right?
And you get better data. You get more accurate
data. Absolutely. I love that you bring the question also about or the example of building the apps and all of that, because it's I think it's often missed that in language access, because language access touches everything else, you have to be an expert of so many different things without really being an expert of it, right? Like you definitely need to be very well versed in anything related to like cultural humility and being responsive in those services, but also need to know some stuff about data analysis if you want to be able to track things and to understand trends and improve services as well. But on the other hand, you also need to be kind of like the expert resident on creating trainings and publications and how to advertise it. So there's like a mix of things that you need to know and of context that you need to have to be able to get the support that you need, right? Being such a niche thing, it also touches everything else, right? Because it's communication. So, and it is also thinking of the way that you were framing, asking the question, an opportunity to build trust, right? You can either make someone feel like make other someone, or you can make them feel part, make them see that they are part already of this that is, our collective, and also without making it a leading question, I would say, because that's, I think, the other part of it, right? And one thing that I personally try to be very mindful of when we're thinking about the surveys that we issue, which, by the way, we issued a questionnaire for community-based organizations, and that they've been so wonderful in completing to help us understand, what we can be doing in this space. And then it will be part of our town hall sessions, like a brief survey. So we make sure that we get information like right then and there that we can track, beyond the comments that we get from folks that come to see us at the town hall sessions. But the struggle is, how do I ask this question in a way that it can still be organized and categorized, but without limiting the feedback that I'm getting, to genuinely be interested in what someone is going to respond, and open and vulnerable to what that answer may be, right? Because if you don't open that window, then we will never know exactly what it is that we can be missing or taking an opportunity to improve.
And there are ways of making the very same question that will get you the answer that you want feel more welcoming without being leading, that makes the person feel, yes, they really want to know what I think. I don't just have to check a box so that I can get through the end of this and move to the next step. And then in terms of culture, there's also the culture of North American healthcare systems that is a unique culture, right? HIPAA doesn't exist in my country, Brazil. Patients' rights and responsibilities, having risks of procedures or surgeries explained in such detail, at such length, can be terrifying for people if this has never happened to them in other countries where, for example, in Portugal, the doctors can be very almost paternalistic, or to me sometimes almost feels a little condescending. Don't you worry your pretty little head, we're going to take care of you. It's like, no,
I worry about the reason why.
I don't want that. I know you're trying to be nice, but I do want to know what I have and how you intend to treat it. But having interpreted many risks before informed consent signatures can be obtained, that's an aspect that folks don't understand. Why is he telling me all these terrible things? Are all these terrible things going to happen to me? Yeah. So just like providers need to be trained how to partner with interpreters, and also need to learn about the culture of U.S. healthcare, which is an unknown to them, in order to be able to comply better, right? It's not that they're ignoring you. You don't want a patient to be labeled non-compliant, because then they won't get appointments. They're going to be viewed as difficult, but maybe it's just because they don't understand what the expectations are of these interactions. So there's just so many places people can fall in the cracks. There's a lot to look at.
Oh my gosh, absolutely. And specifically as a medical interpreter, to your point, right? To be familiar with the legal framework first and foremost, right? And then because we know that as an interpreter, a medical interpreter, we are also an advocate, right? We sometimes have to raise our hands and advocate for our patients. So, which is a very hard, I think. I know a very hard boundary to keep track of, right? There's that, but then there's that added, and I would say probably not probably, definitely more nuanced thing in the culture of healthcare, right? And the things that the protocols or the operational procedures, right? And what are the considerations on top of making sure that language access is available? And I say that because so far it seems like it's still like an added layer. I've seen that, healthcare systems, for example, in New York, are now baking that into part of their intake, right? Not just the question about language, but for example, which language do you read in? Do you have a preference for written language? If someone says, I really can't read in my first language, then why are we thinking about documents? We really need to be more focused again on the interpreting piece of the exchange with a patient. So it brings it back to cultural humility, right? Like I know I've been repeating that all.
That's our theme, because
it's our
you
theme
don't
today, I
know
think.
until
Yeah.
you ask. You can't assume, right? You have to ask. So there are little things that can be done. Not everyone is literate in a language that they spoke in, particularly if they grew up in a house that speaks a language that doesn't use our alphabet.
Mm-hmm.
They may have perfect pronunciation and comprehension, but they may not read and write in Russian or Chinese or Japanese. And some languages don't have really a written form.
Like ASL. Yeah.
So I remember back when we used those little Hallmark cards that you could order online, just sort of generic ones with no greetings, just a little open, and you have 2 minutes of recording time to give people instructions that couldn't read in their language on when to take their medication. Of course, now it's even easier because everybody has a smartphone. You can just ask them to record what you say. Take one every 4 hours, take this one, the pink one, in the morning, or whatever it is. And it jumps that hurdle of, we don't have to ask for it to be translated because this patient does not read in their language, but they do understand that language orally far better than English. So we want to give them a recording, their instructions.
And it even, I think, serves other purposes, right? It's what they call the cut curve effect. When you cut the curve, then obviously you're helping folks whose disability, not whose disability, of folks who use a wheelchair and who will go through that cut curve now that there's a way to go through it instead of that split. But also that's going to help folks beyond that. It's going to help someone who is carrying their baby, perhaps, or someone with a baby carriage, or someone with a cane. So it really goes beyond just the approach of disability access, and it benefits everyone. So like these recordings are great in a language access perspective, but I would also say for someone, who may not remember later on what was the instruction, so it's something they can reference again. It serves more than one purpose, like so many things that technology is bringing for us, right?
Yeah. We have to think of all the out-of-the-box options along with the in-the-box options that we're promoting and have budgeted for in order to cover as many people and catch as many that were about to fall into the cracks, in my opinion. And so there really is no one way to do it. And there's always multiple ways to get to that end point. And each way serves a different scenario.
Absolutely. Yeah. And in that, thinking of the diversity of that approach, and I was left thinking about that ad campaign that you mentioned earlier. And I think the beautiful thing about the most beautiful thing about recognizing the diversity, even within a language or wherever, is that it brings it all back to how each of us are unique, right? And just being able to shed light on that is so special because it lets us really be who we are, bring who we are to work, and also help others be able to bring that to their personal life or their work life, etc. And just it serves us well to have a more authentic life that we can enjoy and feel good about.
Well, I feel good about this interview today, Margarita. I feel good about where New York State is heading. I'm happy you have a team that is talented and energizing you to move forward. There is so much work to do, but before we used to feel isolated and alone and thinking we were the only ones worried about this issue. And over the last 20, 25 years, things have shifted considerably. We now have 2 national certifications for healthcare interpreters. All 50 states have certification for court interpreters. And there are now 2 new, or relatively new, 2-3 years old, organizations for interpreters in education. I see all of this moving us towards a place where certification will be as basic a requirement for interpreters as a driver's license is to get behind the wheel. And perhaps, I don't know, licensure by state in a way to make sure that people have been vetted and have been certified in order to provide this service. But like I said, the idea that this is happening at a statewide level with top-down support is really sort of my dream for the remaining 48 states that have not yet addressed the language access issue as cohesively. Mm-hmm. Every single state has groups organized, whether by city or region or by state, for some subsection of a profession. But I really, really would like to see a little bit more coordination from the top and a lot more budget for us to do what needs to be done so that people can partner for better health outcomes, life outcomes, financial outcomes, educational outcomes, opportunities for career advancement by having access to the language support. They need to become a contributing member of their local community, of our society. And what you and your group are doing helps move that needle so much faster than all the little individual efforts, as well-intentioned as they are. So it has been a real pleasure and an honor to speak with you again today. And I hope you'll come back soon and let us know, maybe 6 to 8 months, what your collection of feedback has brought forth and what your new endeavors will be.
Thank you, Eliana, so much. The pleasure and the honor have been all mine. And I absolutely agree that, being able to continue working and promoting the importance of language access and having the support that we, again, have been so fortunate to have from Governor Hochul and from the Office of General Services, where the Office of Language Access lives, beyond, all the different areas in our agency. Because I will tell you this, also before we wrap up, that it's such a wonderful thing to see that the different areas in the agency and the Office of General Services that we collaborate with, they get so excited about language access, like they're like, wow, this work is amazing. I didn't know like this part of it, or like the cultural component of it. So it's a wonderful thing to be working on because of the importance of it, but because it also energizes other people as well. So hopefully we can contribute to have that happen at other states. We're here definitely to support, and I would be more than happy to join you soon again so that we can talk about, what's happened since that last time that we spoke.
Well, you heard her, folks. Get busy in your respective states. Let's make these changes happen. And stay tuned for our next upcoming podcast. We have some interesting people in the queue all the way through the end of the year. And thank you once again for joining us today, Margarita. Ciao, ciao, everybody.
Adios.